the Panoptix lens implant or the Synergy lens implant? Which is the best lens for presbyopia correction in 2021? So it's September 19th, 2021, and these are the two most commonly used premium presbyopia correcting lenses in our practice. So I started using the Panoptix lens in September of 2019. And since that time, I've probably placed about 1,300 of these lenses for my patients. And then in June of 2021, which is about 3 months ago, I started using the Synergy lens because it became commercially available. So when it comes to the world of cataract and refractive surgery and using these types of lens implants, there's a spectrum of thought. So some ophthalmologists are very cautious and they won't even use these premium lenses because they want to use basic monofocal lenses and they don't want to have to, for various reasons, deal with the pros and cons of these lenses. On the other hand, there is another end of the spectrum where eye surgery practitioners, ophthalmologists, they'll use these lenses more frequently. And we're kind of on the latter end of the spectrum. And the ophthalmologists that use these lenses will pick and choose the patient population that they're willing to use these lenses for. For example, some ophthalmologists will say, we'll only use these premium lenses on patients with visually significant cataracts and otherwise normal anatomy, no coexisting eye problems, normal corneas, normal retinas, etc. We definitely use these lenses in that patient population, but we'll use these lenses in patients who have little to no cataracts at all, who are simply in their 40s, who are needing reading glasses to see up close, and we'll place these lenses in them. So let me kind of walk you through the patient population that I've been using the Synergy lens on in my first 3 months. Between June 16th and September 19th, today, I've placed about 221 Synergy lenses, and 59% of the patients that received the Synergy, they actually had legitimate visually significant cataracts. The other 41% of patients who received the Synergy lens that I placed, they had little to no cataract at all. This was just used for presbyopia correction or what we call premium lens replacement. These patients can see well with glasses. They simply don't want to have to rely on glasses. Sometimes they don't wear glasses for anything other than reading up close. They drive without glasses and they just don't want to have to wear reading glasses for tasks that are near. Out of these 221 Synergy lenses, did we place them in eyes that had coexisting eye conditions? Yes, absolutely. Let's talk about prior eye surgery. So 13 eyes had prior radial keratotomy surgery. 2 eyes had 3-cut radial keratotomy. 4 eyes had 4-cut radial keratotomy. 7 eyes had 8-cut radial keratotomy. How did these patients do? They did well. 28 eyes out of the first 221 had prior LASIK surgery. Myopic LASIK surgery primarily, but some had hyperopic LASIK surgery. These patients did well. And then there were some patients with retina conditions, macular hole, macular degeneration that was very mild epiretinal membranes. Some patients had glaucoma, and there were some patients with endothelial changes or corneal guttata. Most of these patients did well. Of all these patients, there's only one patient who had Fuchs dystrophy who received the Synergy lens who may need to have additional corneal surgery in order for them to see their very best. This probably would have happened even if they had a monofocal lens. Now let's go over the performance of the Panoptix and the Synergy lenses. First of all, long distance vision. I would grade the long distance vision from both lenses to be A quality. What about mid-range vision? I'd say the mid-range vision for both lenses is A quality. How about the near vision? Reading a cell phone or reading a document. They're both A quality. However, the Panoptix has an optimal reading distance that stops at about 16 inches. Items held closer than 16 inches begin to move out of focus, and if a patient wants to see closer than 16 inches with a Panoptix lens, generally they may need some help in the form of reading glasses. The Synergy lens has a slightly more powerful reading capacity. The closest distance that an individual can see sharply up close with a Synergy lens is about 13 inches from their eye. Is there a difference between the severity of the halo effect around oncoming traffic lights, car lights, brake lights at night? Both the Panoptix and Synergy lenses produce a halo around these lights. I would say they're roughly equivalent in the nighttime halo effect based on the feedback from our patients. What about the overall quality of vision? I would say both lenses give overall A quality of vision at all distances, far, mid, and near. Now, there is a slight difference in how fast patients realize their optimal visual clarity. For the Panoptix, it's anywhere between 1 and 7 days for most patients. And for the Synergy lens, it's anywhere between 1 and 14 days. So what I'm finding is the Synergy patients ultimately see very well, just like the Panoptix patients. However, if we see 10 Panoptix patients who had surgery a day ago and see 10 Synergy patients who had surgery a day ago, I would say the Panoptix patients would be a little bit happier and see a little bit better in the first few days or the first week than the Synergy patients. And I'm not exactly sure why that is, but if I look at our patients 2-3 weeks after surgery, I would say the Synergy and Panoptix patients see very similarly, and both groups are very happy with their ability to see at all distances and the quality of their vision. Now, is there a difference in the need for glasses after surgery with these lenses? I'd say both are about the same. There's minimal need for glasses, if at all, with these lenses for most of our patients. And if they need glasses, it'll be from time to time for reading in most circumstances. What's the overall patient satisfaction with these two lenses? Is there a difference? I'd say they're both very high, and I can't really tell that there's a significant difference in the overall satisfaction between the patients who receive the Panoptix versus the patients who receive the Synergy lens. Is there a difference in the rate of explantation or the need to remove either of these lens implants due to patient dissatisfaction? They're both probably very similar. Now, I haven't yet used 300 Synergy lenses. I've used 221. I've had to remove 1 out of 221 Synergy lenses due to intolerance by the patient with their quality of vision. And I created a video of that, and I'll post that video link in the section below this video. Patients with the Panoptix, they have a rate of explantation, in my experience, of about 1 in 300. Sometimes these patients see very well objectively, but they do not like the quality of their vision for various reasons. For example, they may see 20/20 far and 20/20 near, but they just don't like the quality of their vision, or they may be intolerant of their night vision with the halos around lights. Have we used both of these lenses in patients that have had prior radial keratotomy? I have never used a Panoptix in a patient with prior radial keratotomy, so I do not know the answer to that. I've placed the Synergy lens in 13 eyes of patients that have had radial keratotomy, and thus far, all those patients have done just fine. What about the performance of these lenses in eyes that have had prior LASIK? I placed a lot of Panoptix lenses in patients with prior LASIK, and I've placed the Synergy lens in 28 patients who've had prior LASIK. And both these lenses do very well, and there's a super high degree of patient satisfaction with both of these lenses in patients that have had prior LASIK surgery. What about the performance of these lenses in eyes with retinal pathology, such as epiretinal membrane or very mild dry macular degeneration? They're both very good. Now, we do counsel and disclose to each patient who has a retinal anomaly that their retina condition will limit their ability to see perfectly or normally with every lens implant. The patients that we use the Panoptix and Synergy lens in who, for example, have mild macular degeneration, they are highly motivated to have a wide range of focus, and they understand that their mild macular degeneration will limit their ability to see immediately after surgery, and that their macular degeneration will possibly progress due to the normal aging process. So we manage expectations for all these patients before surgery and disclose everything. We show all our cards to these patients before surgery to make sure that we're not overselling or overpromising any aspect about their visual outcome or visual expectation with either of these lenses. Now, is there a visible cosmetic reflection from the lens surface with either of these lenses? In other words, can a person speaking with the individual who has a lens implant in their eyes, can a casual observer tell that there is a lens implant in the eye? Sometimes with the Panoptix lens, there is a visible reflection in certain lighting conditions at certain light angles where the lens implant will create a reflection that's different than the normal lens reflection. But for the Synergy lens, I've not found this to be the case. So which is the better lens? Well, before I share my analysis, I thought I'd introduce to you and share with you the thoughts of two of our optometrists who are an integral part of our eye care team. So I'll do the preoperative exam and surgery, and for most of the patients, they're going to be seen by one of our optometrists for their 1 day, 1 month, and subsequent follow-ups. The vast majority of our patients do well, and their post-op care is very routine. However, if our patients have problems, are unhappy, or need to have a subsequent fine-tuning procedure, they'll be referred back to me, and I'll manage the patient. So let me introduce to you two of our wonderful optometrists, Dr. Kimberly Pham and Dr. Christina Wenn, and they'll share with you their thoughts about the Panoptix and the Synergy lenses.
I'm Dr. Kimberly Pham. I'm one of the optometrists at Austin Eye. I do the post-operative cataract surgery appointments, and I also do the medical eye exams at Austin Eye.
Hi, my name is Christina Wenn, and I am an optometrist at Austin Eye.
So after the patient does the cataract surgery, I usually am the one who evaluates them the day after and the month after and make sure that everything is healing well. And then also I'm the one who does their annual eye exams if they want to from there on out.
So I see all of the post-operative cataract and premium lens replacement patients for their 1-day visit and their 1-month visit at Austin Eye.
We've been doing Panoptix since about 2019, so I've seen, I would say, several Panoptix post-ops, I would say hundreds of post-ops there. And then for Synergy, we started doing it in about June of 2021. And so with that, maybe about 100 or so Synergy lenses.
So I have seen around 500 Panoptix patients over the course of the last year. And since June of this year, I've seen around 50 Synergy patients.
So far, what I've observed is that the Panoptix patients on the 1-day post-op seem to be kind of like wowed by it. Like I'll see 20/20 J1 Plus pretty often. With Synergy lenses, I feel like it's taking a little bit longer for the wow factor to come. Usually on the first day I see that their J1 Plus seem pretty well up close, but their distance vision is still a little blurry. Unless patients are coming in like, oh my gosh, I can see great already on the 1-day post-op. By the 1 month, I think that Synergy is not really performing as well at distance as up close. And Panoptix is doing pretty well at distance and up close. Yeah, so at the 1 month mark, usually I feel like with the Synergy lens, the distance is a little bit blurrier than the near vision compared to the Panoptix.
So some differences and experiences between the Synergy and the Panoptix lens has been in their day 1 visual acuity, both at distance and up close. I have experienced that in the Synergy lens, the distance and up close is blurrier than Panoptix at the 1-day follow-up visit. However, at the 1 month visit, the vision, both far and up close, stabilizes around the same visual endpoint.
I think in general, patients are more wowed by the Panoptix lens, and that's just what I've been seeing at the 1 month post-op. Synergy patients, I feel like they're like, oh, okay, this is good. I don't really have to wear my glasses. But Panoptix patients, I feel like they feel like the quality of the vision is better.
I think that the patient satisfaction in the Synergy and Panoptix lens is very similar, both at distance and near.
I don't think there are any differences in the side effects. I did have a patient talk about how they don't notice the halos as much with the Synergy lens, but other than that, nothing else. The halos are about the same between the Synergy and Panoptix. I do notice that people with the Synergy lens at the 1 month post-op are feeling like near vision is great, but distance vision is a little blurry. With Panoptix, I feel like patients are saying distance and reading are pretty decent.
I have not seen a significant difference in the side effects or visual acuity at distance, intermediate, or up close. I haven't seen a significant difference in the amount of glare or halos comparing each of these two lenses.
So if I were to recommend a lens for a patient, I would say as of right now, with the results I've been seeing, I would choose the Panoptix, just because I don't know, the Synergy lens has not been impressing me too much, especially at the distance. And Panoptix has been doing really well from the first day after I see them. I feel like the Panoptix lens has been giving higher quality of distance and near vision than the Synergy lens. So even if they are seeing 20/20, in my experience, actually, Synergy, the patients are not quite seeing 20/20 at the 1 month mark in the distance as often as the Panoptix lens. And when they are, they just don't seem as amazed by the vision with it. I feel like at the 1 month mark for Panoptix patients, if their refractive error is like plano, sphere, we hit the target, they're like, oh, distance is really sharp and near is really sharp. With Synergy, they're just happy, and they're not saying, oh, this is like really awesome, this is great, but they're just happy, like, okay, this is good, I don't need to use my glasses. They're not blown away by the vision. I'm Team Panoptix for now.
Really interesting.
For now.
No, I'm going to.
At this point, I think that I would still recommend the Panoptix lens over the Synergy lens, just because I feel that the visual acuity, you're able to obtain that visual acuity earlier on in the postoperative period, and the visual experience, the side effects are very similar between the two lenses, so I would still recommend the Panoptix lens as my lens of choice.
Some of you who are watching this video may not completely understand the context or the background on why we use these lens implants, how we use them on patients with visually significant cataracts, or how we use them on patients who see fine, but they're around the age of 50 or maybe a little younger than 50, maybe a little older than 50, but they definitely don't have visually significant cataracts. They just want to see younger so they don't have to rely on reading glasses. How do we use these lenses, and how do they work? Well, I'm going to place links to 2 videos in the section below. One of them was created in 2019. It's called Symphony versus Panoptix, which is the better lens. And then another video was created in April of 2021, and it's entitled Over 45 and Considering LASIK, Lens Replacement, or Cataract Surgery, All You Need to Know. So feel free to click on those videos below if you want more foundational information on how these lenses are used. So at this point, some preliminary conclusions. These 2 lenses are pretty evenly matched. In fact, both of our optometrists preferred the Panoptix lens. So ultimately, how do I decide which lens is best for a patient who wants to see far, mid, and near with the least reliance on glasses? One of the things I look at is the ratio of happy versus unhappy patients. And the patients who are very, very unhappy, bitterly unhappy with these lenses, fortunately, they're few and far between, about 1 out of every 300 patients. But if I have to remove a lens because a patient is unhappy with their quality of vision or any aspect of their vision, then we take that very seriously. And that does influence how I choose which lens. Additionally, I do see quite a number of patients who have surgery outside of our practice. Maybe they had surgery at another practice in our region, or they'll actually find some of these videos online, and then they'll come in to see me and they'll want to have a lens changed out. So I do see a significant number of patients who want what we call an intraocular lens exchange, where we remove one implant and then replace it with a different type of implant. And as I mentioned before, I've had to remove one Synergy out of 221 and about 1 out of every 300 Synergy patients. So, but I actually think the rate of explantation due to patient dissatisfaction between these 2 lenses, it'll actually be very, very similar. And on a personal note, if you're watching this video and you've made it this far, thanks for watching. And I appreciate your comments. I appreciate your questions. A lot of you will ask very specific questions, such as they'll give me some of their background information, and then they'll ask me, what should I do? And though I understand you're wanting to get information, I can't legally give medical advice online without examining your eyes. So if I don't respond to these types of inquiries, it's because I can't give a really useful answer for anybody unless I've examined that patient myself and we have a doctor-patient relationship. Another common question is, hey, if I have the Panoptix lens placed now, can 5 or 10 or more years from now, I have that lens removed and replaced with a lens, say in the year 2026, that does not exist now, is not commercially available now, but when it comes out and it's proven to be better than the Panoptix, can I have my Panoptix lens removed and replaced with the lens of the future? though it's theoretically possible, and the name of that procedure is called an intraocular lens exchange, and we do those types of procedures, we do not recommend that patients plan on having their lenses removed. Plan that if you choose a lens implant, that it's going to stay with you for the rest of your life. Your vision should be high quality, very stable for the rest of your life with the implants that we're currently using. And if lens implants in the future come out, I would recommend that you keep the lens implant that you currently have, because removing a lens implant and replacing it with a different implant years later, there's all sorts of different complexities to that discussion and that process that it would be extremely time consuming for the individual and for the surgeon to pursue that type of work when we're doing so many lens implants currently. In general, if your lens implant works, then plan on keeping it for the rest of your life and don't plan on having it removed and replaced with a lens in the future. That being said, there are some patients who are absolutely miserable with their lenses, and they will come see me, and then we'll have a very long discussion about why they're unhappy with their lens, what they can see, what they can't see, and what options and alternatives are available to them. And for these patients, sometimes we'll perform an intraocular lens exchange. We'll remove the lens that they're unhappy with, and then we'll replace it with the lens that hopefully they'll be more happy with, that gives them better quality of vision. For patients who are unhappy with a lens implant that is designed like the Synergy or the Panoptix lens with rings in it, the rings confer a benefit. They give the individual the capability to see far, mid, and near with the least reliance on glasses. But the rings also have a side effect. They will create a halo around lights at night. And some patients simply do not like the quality of their vision when they see through a lens implant that has rings such as those found in the Synergy and Panoptix lens implants. And for those patients who are very unhappy with these multifocal implants, I have found that this lens, the Vivity lens, seems to work pretty well at improving the quality of vision for these patients. The Vivity lens delivers excellent far away and mid-range vision, but all the patients who have a Vivity lens will need reading glasses to see up close. This lens does not perform as well as the Synergy or Panoptix lens for up-close reading. The Vivity lens delivers excellent far and mid-range vision with minimal night halos. It does not, however, deliver great reading vision. Therefore, patients who we implant a Vivity lens will need reading glasses for up-close work. So what is the best premium presbyopia correcting lens in 2021? Both deliver great vision at all distances for most patients. Some patients will not like either lens and want us to exchange it for a different lens. In these rare patients, I'm finding the Vivity to be a great alternative. I posted a video on August 9th, 2021, titled "There is no perfect lens implant: How to manage the unhappy patient with a Synergy lens," which I'll share the link to in the section below. Well over 99.5% of our patients are very happy with their vision with the Panoptix and the Synergy lens. So it's almost a tie, folks. But as of today, September 19th, 2021, if I had to pick one premium presbyopia correcting lens to use in my own eye or for you, the patient, I would pick the Panoptix second, and I would pick the Synergy lens first. It comes down to the lens material. The Synergy lens is made of an acrylic material that simply looks better inside the eye through the microscope, and cosmetically it looks completely normal. The Panoptix lens, as great as it is currently manufactured with an acrylic material that causes a cosmetic reflection that may be seen some of the time at certain lighting angles. Also, over decades, the Panoptix material can develop microscopic changes within the lenses called glistenings that may ever so slightly interfere with vision. That being said, I've placed lens implants using the material that the Panoptix is made from since 2005, so that's 16 years, with regularity. And I have never had to remove or replace one of these lenses due to glistenings. So there you have it. The Synergy lens is my preferred lens for premium presbyopia correction. And the Panoptix is still a wonderful lens that we continue to use for our patients, but I would place it a close second to the Synergy. And we also use the Vivity lens for patients who want an extended range of focus for far and mid-range, but are willing to use reading glasses for near work, and who want to avoid having a night halo around lights that patients will see with the Synergy and Panoptix lenses. So let me share with you a concept that I think is important to realize. There's no perfect lens implant. We can't guarantee that a patient will never need reading glasses. But in the history of humankind, there's never been a better time to have cataract surgery or have your vision corrected with a lens implant if you're aging and you don't like having to rely on reading glasses. The technology and the outcomes for correcting vision has never been better in the history of humankind, and the overwhelming majority of our patients are extremely happy. And that small group, that small sliver of patients that's not happy, I would say we have very, very good options to help them see better, even if they're not seeing as well as they want after their first surgery. So that's the good news. Now, if you have comments or questions, please feel free to share them in the section below. I hope this video was helpful. Thank you for your time. Thank you for your attention, and have a wonderful day. Bye-bye.